This is more like a slow-moving tsunami, where human life, as we know it today, might not be the same kind of life we see just 30 years from now. The reason being, is if you think about safe childbirth, if you think about surgery, if you think about immunotherapy for cancer, and many of the medical interventions that makes our lives longer and more healthy, more productive, might no longer be possible.
There's also the issue of timing.
Right.
I mean, this is happening on Friday is New Year's Eve for the Chinese. This next week is like the biggest traveling time of the year. So this could have happened in the middle of the year and it would have been different. But the timing of these things is often, and that's not predictable.
A preliminary investigation into a mysterious pneumonia outbreak in China has been identified as a previously unknown coronavirus.
We have a really interesting topic to talk about here today. So, Dr. Hache, I'd like to really start with you and ask you a question that is increasingly on our minds this week in particular. The world has seen a growing number of epidemics in recent years: Ebola, Zika, SARS, and now we're hearing reports of the coronavirus outbreak in China. Could you speak a bit about the likelihood of these events becoming a global threat, and how prepared are we to respond?
Well, thank you for the question. It's a very timely question, obviously, with the emergence of the novel coronavirus. I've been working on epidemic threats and epidemic response for about 20 years, both in my current role and previously in the U.S. government. I think the risk of epidemic disease, you talked about the increasing number of threats. I think that is a real phenomenon. I don't think it's that we're increasingly attentive to them. I think it's a real phenomenon. I think it is related to how societies are currently organized and the complexity of societies, the speed with which people move around the world.
New cases have now appeared in Europe and in 6 other countries, and a second U.S. case was confirmed today.
10 days ago, there are only 41 cases of novel coronavirus. Now, there are more than 1,200.
The initial outbreak in China has now spread to at least 6 other countries, including France and the U.S.
The city is on ever greater lockdown, with cars now banned. 56 million people in the region are under a travel ban.
There are now 35 cases outside China in 13 countries or territories. Today, Australia and Malaysia joined this growing list.
The rest of China is closing off.
Shanghai Disneyland, Disneytown including Walt Disney Grand Theater and Wishing Star Park are temporarily closed now.
Disneyland Shanghai should be packed over the New Year's break. Instead, it's empty.
Today is the biggest holiday in the country, the Chinese New Year, and cities in the hot zone are on lockdown. Police are armed with long guns, making sure no one enters or leaves.
I think the most concerning thing is this massive quarantine of over 35 million people, the largest quarantine ever undertaken in human history.
I think the concern is that the diseases that we see emerge have I would almost say, a Darwinian imperative to find, communities where they can break out and propagate. And Ebola is a great example. Ebola was discovered more than 40 years ago and ultimately found in West Africa sort of a perfect setting in which you could have a large explosive outbreak. And now we're in the midst of the second largest outbreak of Ebola ever. So the 2 largest Ebola outbreaks ever have both occurred in the last 5 years, and I don't think that's a coincidence. Now we're seeing the emergence of a third coronavirus. SARS was the first coronavirus that we had significant concerns about. It broke out in 2003. MERS came along a decade later. Neither of those viruses was very easily transmissible. They were transmissible. They caused a lot of disease. But we knew that coronavirus as a class represented a threat to humanity. And what people are concerned about now with the current coronavirus is perhaps this is the coronavirus that we've been fearing, which is one that is more easily transmissible than SARS or MERS, and with the lethality that is sufficiently high that if it became a globally disseminated disease, could potentially, affect a very large number of people and potentially cause tens, hundreds of thousands of deaths, or even millions of deaths. And that's a really frightening prospect. Just to conclude, I think we need to acknowledge that these epidemic diseases are, in fact, a structural threat for the societies that we've created for ourselves.
Tom Boyke says this novel virus in China is not yet cause for alarm for Americans. There are plenty of other viruses right here to worry about.
We're in the midst of a terrible flu season.
Alarming new numbers tonight in the nationwide flu outbreak. Flu activity is now high in 34 states. It hasn't been this widespread this early in the season in more than a decade.
And more cases of a deadly virus from China are popping up all around the world.
Health leaders say that the number of people statewide being hospitalized for the flu has more than tripled compared to last year.
Today, the CDC reported there have been more than 55,000 hospitalizations this flu season. Usually, the predominant strain is influenza A, but this year it's been influenza B so far.
But we also have a much more questioning public. And I think that there's a lot of things that are converging right now that it's about complex threats. I mean, there's the whole digital revolution that has added a whole level of opportunity on the one hand, and yet threat. I mean, the Global Risk Report, the 2013 one, coined this term digital wildfires in a hyper-connected world. I've referred to that phrase a lot. And actually, I really like the parallel to wildfires, particularly right now when we look at what's happening in Australia. One of the things the physicists and engineers have said about trying to, analyze these patterns of these new fires, and what they've said is they're burning hotter, faster, and less predictably. And I couldn't think of a better metaphor than some of the diseases.
And I think Heidi made a very important point, which is worth underscoring, which is how, particularly with vaccine hesitancy, but even to some extent with antimicrobial resistance or with epidemics, I mean, these are kind of represented here. These are the three great narratives, in sort of infectious disease at the moment. And then each of them underneath, and I think you outlined it for vaccine hesitancy very well, brings together a constellation of narratives that interact in ways that are very unpredictable, and then you superimpose digital wildfires and social media, and it becomes really, really toxic. And so you're about to see, I would predict with Wuhan, you're about to see social reactions that are probably going to be disproportionate to the current threat, at least, and they're going to cause tremendous damage in much the same way that you see social reactions to these narratives swirling around vaccine hesitancy.
In DRC, our challenge is also there's conflict, insecurity. We haven't eradicated polio because of conflict and security in the northwest frontier in Pakistan and in northeast the Boko Haram in Nigeria. It's no coincidence that they're harboring the remaining wild virus in the world. And by the way, polio is coming back. Mm-hmm. We've had the Philippines case. It's come up now in Malaysia. We had a case in Ukraine a few years ago. We didn't have the security issues that we have now in Pakistan and Nigeria. It was actually, we weren't even worried about Pakistan. We were more focused on a small section in India and a boycott in Nigeria, and which we resolved, but we wouldn't have been able to do that in the current environment.
And this goes back to the point that I was making about these being sort of an inherent risk in the societies that we've constructed for ourselves. There is almost an actuarial risk. And we saw Nipah in 1999 and SARS in 2003, H5N1 in 2005, H1N1 in 2009. These things, they're all different. You can't predict what it's going to be next time, but they're coming along at every 2 to 3, maybe 4 years at the outset. And the risk tolerance of society for infectious diseases has decreased dramatically. And part of the reason it's decreased dramatically is because the disruption that they cause, because of the interdependencies within society, the economic costs have become astronomical.
This was already ambitious, to build a 1,000-bed hospital from scratch in less than a week. But authorities have decided it will not be enough. A second, bigger hospital has been commissioned. Each hour seems to bring a new measure from the Chinese government, and that seems to offer the opposite of reassurance. If the response is like this, how big must the danger be?